All righty, this is a pretty shocking story. You know, we've been talking how people on Medicare Advantage, which of course is private health insurance, are routinely getting turned down when they try to get claims paid. And so, you know, they end up going to the doctor and then they get a bill because the insurance company that has their Medicare Advantage plan says, oh, you know, we're not going to cover that test. This story starts out, this is from ProPublica. This story starts out with a physician himself, a retired physician. His name is Nick Van Terheiden, and his bones were in pain, and he thought it was his vitamin D levels. And so he went to his doctor, and his doctor ordered a vitamin D test, and his insurance company, Cigna, said they are not going to pay for this $350 test, blood test for vitamin D. And it was signed by one of their medical doctors, medical directors, a physician. So, you know, he dug into this and discovered that this was Dr. Cheryl Dopke, D-O-P-K-E, who was the medical director who signed this. It turns out his claim, I'm quoting from ProPublica, his claim was just one of roughly 60,000 that Dopke denied in a single month last year. The company has built a system that allows its doctors to instantly reject a claim without opening the patient file, leaving patients with unexpected bills. Over a period of 2 months last year, Cigna doctors denied over 300,000 requests for patients using this method, spending an average of 1.2 seconds on each case. One former Cigna doctor said, "We literally click and submit. It takes all of 10 seconds. I can do 50 at a time." Under California regulations, they have to provide a thorough, fair, and objective investigation. This is what Cigna calls that. They adopted the system a decade ago, but pretty much every other insurance company does the same thing. And this is why, you know, with Medicare Advantage, I mean, this isn't just Medicare Advantage, this is all health insurance, but also Medicare. Cigna emphasized that a system does not prevent a patient from receiving care, only that they won't pay for it. Right. Dr. Alan Money is the guy, M-U-N-E-Y, is the guy who invented this back in 2010. He was managing health insurance companies for Blackstone, the investment company, and then Cigna hired him. He used to work at United Healthcare, where he was an executive, and he built a similar system. Dopke, the doctor who turned down the fellow I mentioned at the beginning of the show, rejected 121,000 claims in the first 2 months of last year. Dr. Richard Capek, C-A-P-E-K, another Cigna medical director, handled more than 80,000 instant denials in the same time span. Dr. Paul Rossi, another doctor at Cigna, 63,000 claims in 2 months that he rejected.
Listening to the Thom Hartmann Program. Call 202-808-9925.
Not only is this why nobody should ever sign up for Medicare Advantage, which puts you right in the clutches of these SOBs, but also why we need Medicare for all and we need to get them out of the business.